I'm Dr. Troy Harris, podiatrist in Jacksonville, Florida. Should you go to a podiatrist or an orthopedic surgeon when you have a foot or ankle problem? Podiatrists go to 4 years of podiatry school. When I was in podiatry school, it was within a medical school. We took the same basic science courses: anatomy, physiology, pathology, biochemistry, etc., pharmacology, etc., as the medical students. We were graded on the same curve, uh, but podiatry school is 4 years, medical school is 4 years. Medical school is more difficult to gain acceptance to than podiatry school is, but once you're accepted into podiatry school, getting through it is just as difficult, I would say, as medical school. Upon completion of training, podiatrists go to a podiatry residency. Medical students can compete for an orthopedic surgery residency. It is a competitive residency for medical students to obtain. It's a 5-year program. Podiatry residency is a 3-year program. From day one of podiatry school, podiatry students are geared, their training is geared towards the foot and ankle. They are trained in biomechanics and specific pathologies that affect the foot and ankle from day one of school. So they get a little bit earlier exposure to the specialty of foot and ankle medicine in podiatry school. Orthopedic surgeons undergo probably a more consistent surgical training program than podiatrists do. Even though all podiatrists today do 3-year residencies, there is some variability between the residencies on what surgeries the podiatrists are exposed to. Some residencies may be more focused on pediatrics, other programs may be less focused on surgery, and other programs may be more surgery intensive. Some programs may specialize more in diabetic foot and ankle salvage, and other podiatry residencies may be more trauma focused. So what should you do if you have a foot and ankle problem? Well, I'll give you my personal opinion. I've been in practice for 10 years. I started out as an active duty podiatrist in the United States Navy, treating active duty Marines, and I transitioned to private practice after that. And if you come to my office and you have a foot and ankle problem, I generally will categorize your treatment options into let's say 4 to 5 categories. So we'll discuss the surgical treatment option, we'll discuss the treatment option of biomechanics or orthotics, bracing, padding, we'll discuss the option of medications, and we'll also discuss regenerative options such as stem cell type therapies or shockwave therapies or laser treatments. They each can be effective for different pathologies. There's also referrals that can be made to physical therapy. So a lot of times when you have a foot and ankle problem, your issue is going to be is likely to benefit from not just one of these options. So you may need a combination of things. You may need surgery, and you may need physical therapy after surgery, and you may need biomechanical or orthotic therapy before or after surgery. So let's talk about surgery for a moment. Foot and ankle surgery is a risky business. If you have foot or ankle surgery and it goes bad, you don't have a good outcome, it can disable you long term. You can have long-term pain, scarring, and problems. So it's not something to take lightly. So in my opinion, when deciding whether to go to a podiatrist or an orthopedic surgeon, just know that number one, I wouldn't go straight to surgery. Some things do have to go straight to surgery. If you have a broken bone that's displaced and it needs to be fixed, then conservative treatment is not going to be adequate for that. But other problems, quite often in my experience, I try to avoid surgery at all costs. So whichever doctor you decide to go to, I think it's difficult to say that one is better than the other, but I do believe that whichever one you decide to go to, I would be sure that the conservative treatment options are fully explored and utilized before you do surgery if it's something that does not absolutely require surgery. So I'm not saying that a certain group of doctors is better at conservative care than another, but I will say that when choosing your doctor and who to go to, regardless if they're a podiatrist or an orthopedic surgeon, some of these doctors tend to do more surgery, and other of these doctors tend to focus more on conservative care. So let's just talk, for example, if you have a hammer toe. A hammer toe generally is not going to straighten out on its own. So often you have to decide, are you going to have surgery for the hammer toe? Well, if it's an elderly patient, for example, I will try to cut a hole in the top of their shoe if their toe is rubbing on top of the shoe and causing pain or ulceration. In their elderly, that's often a much better choice than surgery to fix the toe. Let's say that you have a prominent bone, a misplaced, or not misplaced, but misaligned bone in the foot that's protruding plantarly at the bottom of the foot, and it's causing a pressure spot, causing pain. Then I will try to do conservative treatments first before you go into surgery to realign the bone. One of the conservative things that can be done is to take an orthotic or an insole and make a depression in the insole where the protruding bone is, and that can reduce the pressure on the bone when you walk. So those are two examples of how conservative therapies, non-surgical therapies, can be utilized without necessarily going too quickly into surgery.